According to a recent report, over 223,000 West Virginians have been diagnosed with diabetes, which represents over 15% of the adult population in the state. For part one of this month's health check, I'm joined by expert Dr. Ravindra from WVU Medicine Camden Clark to learn more about diabetes. Dr. Ravindra, thank you so much for sitting down with me.
Thank you for having me.
Of course. So the first thing I want to ask you is, what is diabetes, and can you just talk about the different types?
So diabetes is a chronic condition where your body is not able to handle blood glucose in an adequate manner. And so that results in high blood glucose in your blood. And that high blood glucose can lead to a host of complications. There are many different types of diabetes, but the most prevalent one is type 2 diabetes, where your body isn't producing enough insulin, or your body is not able to use that insulin in an adequate way. And we use the term insulin resistance for it. And most of the time, it's a combination of both of them. And the less prevalent one is type 1 diabetes, where it is an autoimmune process where the cells that produce insulin are being destroyed. And so people are in an insulin deficient state and require insulin to survive. And there are other less common types of diabetes, such as gestational diabetes as well. This is a type of diabetes that is diagnosed during pregnancy. And this diabetes can be reversed after giving birth, but these patients are at a very high risk for type 2 diabetes, and we do recommend screening in a timely manner. And then there are other forms of diabetes induced by high-risk medications. And the most common ones that we encounter in our society is steroid use, people getting joint injections or chronic steroids, people with immunosuppressive agents such as transplant medications, or certain chemotherapy agents as well. And there are rarer forms of genetic diabetes as well. But for the interest of our talk today, I think we should focus more on type 2 and type 1 diabetes.
Right. And so talking about those two different types, what kind of causes it, and is it preventable?
Type 1, not necessarily, because there are different etiologies that are being proposed, and the most prevalent theory is an autoimmune process. So right now we don't have, while we have medications that can delay the onset of type 1 diabetes, we don't necessarily have anything to prevent that. Type 2 diabetes, however, if it is detected early, it is preventable, because you do go through a stage called pre-diabetes, and that's why we advocate for going to your primary care and getting yourself checked out in a timely manner. And most of the time the recommendation is 35 years, and every 3 years or so if your blood glucose levels are normal, but at an earlier age if you have high risk factors such as obesity or being overweight.
Right, and so you talked about, detecting it early on, but what are those early warning signs for people that they can be looking out for so that they can detect it and, get it taken care of early?
So some of these symptoms of high blood sugars can be a little misleading because they can be very nonspecific, but you want to watch out for symptoms of excessive fatigue and not being able to have energy to carry out your daily activities. You can be excessively thirsty, or you can be going to the bathroom a whole lot, or you can have tingling and numbness of your hands and feet, or blurry vision. The extreme state would be, not having a loss of appetite, not being able to eat properly, and losing weight. But I would recommend for people to go to their primary care physicians and actually have their glycated hemoglobin A1C checked out, or have a fasting blood sugar checked out, or some form of a diabetes screening checked out to be absolutely sure.
Okay, great. And Dr. Ravindra, before I let you go here, is there anything else that you would like to add?
I do want to say that diabetes is a major public health burden, and we do need to make all efforts to detect this early, as like we mentioned, it is a preventable cause, and we want to make sure that our educational efforts are out there in the community, and we want to talk about lifestyle modifications such as diet, such as exercise. Just 30 minutes a day of moderate activity 5 times a week is more than enough to have that increased physical activity for you. Or just addressing and being more mindful of what we put inside of our body in terms of our diet is very important. And just losing about 5 to 10% of our body weight definitely decreases our risk for not only type 2 diabetes, or if someone has type 2 diabetes, decreasing our medication burden, but also decreases our risk for cholesterol, for high blood pressure, etc. Yeah.
Right. Well, Dr. Ravindra, thank you so much for sharing your wealth of knowledge on this topic, and we're excited to have you join us again for part 2 of this conversation. conversation as we'll talk more about the impact on your body and your organs specifically. Dr. Ravindra, thank you so much.
Thank you for having me.
Of course. When we return, we'll have one last look at your forecast. Stay with us.